Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Today, my special guest is Laura MacNeill, who is the CEO of Global Lyme Alliance. And I'm thrilled to have her here today. I've been waiting for a long time for this interview. So Laura assumed the role of CEO of Global Lyme Alliance in July 2022. As CEO, she heads the leading private nonprofit dedicated to Lyme and tick-borne research, awareness, and empowering the patient voice. Laura directs overall strategy, operations, and fundraising to increase awareness and hasten advances in diagnostics and treatments with the ultimate goal of finding a cure for Lyme and other tick-borne diseases. Laura joins GLA from the Leukemia and Lymphoma Society, where she previously served as executive director. Laura brings nearly 15 years of experience as a senior executive, executing strategic nonprofit planning, innovative marketing, fundraising, and raising public awareness. Laura is an avid athlete and takes part in century rides and triathlons throughout the year. Laura and her husband Adam have 2 children. They are ages 9 and 7, and they all live outside of Boston. Welcome to Lyme Time, Laura.
Hi, Allie. Thanks for having me. I really appreciate it.
To me, Global Lyme Alliance is sort of the overall hub for Lyme disease, if you will. It gives if anybody goes on to GLA, it's really just chock full of so much information, so many resources. It's there for you. Everything in there is for you. Everything is at your fingertips, including peer-to-peer groups and also just healthcare provider services, which we'll get into in a minute. But first of all, I want to ask you, Laura, as a person, what made you drawn to the advocacy for Lyme disease?
Yeah, thank you. So I've spent my career now, as you just read in my bio, in the nonprofit sector. I've fell into nonprofit work. I certainly didn't come out of the gate thinking this is what I would do, but I've always been drawn to helping others. I spent the better part of the last decade, a little bit more, working in a blood cancer organization, but learning, really top-notch the tips and tricks and the way to move a volunteer to be able to get behind a mission and create a movement to make the world a better place. And that's now what I can give back to the organization because I have such excellent training there. And I met Global Lyme Alliance through just my network when they were searching for the CEO position. I live in Massachusetts, so I live in a Lyme endemic area. I'm not from here. I'm originally from Pennsylvania. So when I moved here with my young family, it was tick fear everywhere. And Pennsylvania has a big tick problem too, but in Massachusetts, they understand it's a problem and they're bold about it. And you hear about it constantly. There's signs up on trails. And so I knew this was a problem. When I found GLA and began the interview process and got to know the board of directors and key stakeholders in the organization, there were so many reasons to say yes. So first, the staff and the board, now I'm meeting them very, very, very early out of the pandemic, right? So this was a group that had to band together, buckle down, and stay true to this mission in a time where everyone was talking about a different infectious disease. And that really meant a lot to me. I knew how deep this mission was for the board and for the staff and how important it was right from that behavior alone. Second, the board of directors are so passionate. I think I have some new board members since I've been here, but when I got here, I would say the smallest tenure was probably a decade. And these folks have spent, this is a life passion for them to cure this problem. And that moved me. And third was the case for support. You have an emerging problem with tick-borne infection. You have ticks that are spreading further across the country because of domestic travel and increased temperatures in the air, and the ticks are staying awake longer, and a very, very big gap from that to education of what really you could get from a tick bite, and the resources that are available for patients. So seeing this, huge divide and this huge gap really was a problem that I feel like I could bring my skills to solve. So I said yes to come to GLA. That was last July, so a little over a year and a half ago. And I had to fully immerse myself in this huge, complicated disease space. I have a ton of books back here. my chairman's been encouraging me to read or the documentaries, and just listening to patients and listening to people and starting to understand what the problem is, and starting to bring the expertise that I have in structure and process and motivation to make connections across this community and try to start bridging the gap and solve the problem. I believe, Allie, that this is a solvable problem, but it always takes time and resources and relentlessness to make it happen.
It really does. And we are so blessed that you took the position on, and that you're just really jumping in and dedicating your passions into our community, because we need more people like you, quite frankly, to bring so much awareness to everyone. I will say that GLA has awarded over $17 million for Lyme and tick-borne illness research to date. Some important areas that I want to just briefly gloss over of targeted support that GLA offers include pediatrics, which is a huge, mental health, which we're learning more and more about these days. Diagnostics, of course, testing is what probably all of our listeners would be shaking their pom-poms, and really highlighting that area. University research, which I think a lot of people don't really know a lot about, what kind of goes on behind the scenes at GLA, and also patient support. So can you tell us a little bit more about these categories and what's going on with them, and why they are listed as your top priorities?
Yeah. Well, GLA, our primary mission is to support innovative research. I mean, I know that you appreciate that. We have a huge gap. I heard you say it in diagnostics, and it's a glaring sort of sore thumb in this entire picture of, if we can't get an accurate diagnostic to know exactly what's happening in a patient, what they have, when they got it, and what's going on in their body, we are going to fall behind and fall short of any treatment options, healthcare codes to help get this covered by insurance, and educating medical professionals on what's really going on. And so there is a lot of need today. Research takes a lot of time and a lot of money. So gratefully, GLA has been funding research for years. I mean, like I said, even through the pandemic, they kept those grants going so that we can proudly say we've invested over $17 million in this work. And it sort of runs the gambit. I think there's such a great need compared to other disease spaces that we've been able to touch a lot of different buckets. So to talk about what you've asked in terms of, academic research centers at universities, GLA helped establish the first ever academic research center for chronic Lyme at Columbia University. So that's just one example where we came in with a $2 million endowment. And this was to start to add credibility to chronic Lyme, start to help study what is actually going on with patients that can't clear this out of their system, that remain, their new baseline is very different if they can ever achieve a new baseline, right? But their body's completely out of whack. They needed a place to go and needed a center to start studying that. Out of that center, there's been a lot of really exciting research, but one project that we're most proud of is a study on Lyme disease and mental health, as you mentioned. Unfortunately, the highest reason for mortality for a Lyme disease patient is suicide. It's loss of life. And so, what we wanted to do is better understand and equip patients with the advocacy that they need to be able to tell their medical professionals, I don't feel right. And I think this could be a medical reason and not just a mental health reason. So what that study discovered was that Lyme patients, or folks that are infected with tick-borne disease, have an incident rate of in the 70th percentile of having a mental health issue alongside of it. You're talking depression, suicide ideation, sometimes it's OCD. And so we found this correlation. We're able to publish that study, and it's on our website if anyone wants to go and take a look at it. But if you're feeling that you're having some mental health issues and you know you've been infected or you think you might have been, there is a direct correlation between those two things. And that was a really critical study that came out of the Columbia Center. That center is still actively doing research, and we're very proud that we have a partnership with them. When it comes to treatment, our biggest, most exciting sort of today action is our investment in hygromycin A. So Dr. Kim Lewis is a very prominent researcher in this space. We started funding Dr. Lewis years and years and years ago. I mean, obviously way before I got here, because he was really taking a look at hygromycin A. Now, hygromycin A is an antibiotic. When antibiotics were all first discovered, hygromycin A was there. It's not new. It's just that when antibiotics were starting to emerge in the medical community, it didn't do a really good job of clearing out broad spectrum infections. So sinus infections, and if you got a cut on your leg, it really didn't do well. So it got shelved for a long time, and it's not one of the prominent antibiotics we use today. It is FDA approved. You can use it. But what we didn't know until Dr. Lewis started really taking a look is, wow, this antibiotic is pretty specific to spirochetal bacteria alone. So in terms of Lyme disease, that's very exciting, because that means that this could be a targeted medicine, a precision therapy for individuals who have a spirochetal infection. That's, also other diseases like syphilis is another really prominent spirochetal bacteria. And so we have funded Dr. Lewis for a number of years. He's now partnering with a organization called Flight Path Bioscience, and we are investing in that company and partnering with the CEO, Matt Tyndall, and still working with Dr. Lewis. He spoke at our research symposium this last spring. He was our keynote speaker, and helping to get their hygromycin A to be approved for Lyme disease and a few other diseases as well. So they're starting soon in January. They're going to do their first round of human clinical trial in Australia. It should run for about 6 to 8 months. And what they're doing there is they're testing hygromycin A on people who do not have Lyme disease. It has to be a healthy cohort, and Lyme disease isn't really known in Australia. So it's a great place to go and find a handful of patients that can jump in and say, yeah, I don't have any side effects from this. Then they're going to bring the next round study into the United States, and they're going to start testing it on folks who we know have been exposed to Lyme disease. So that's very exciting in terms of treatment.
That's so exciting. Is Dr. Lewis out of Columbia?
No, Dr. Lewis, I'm going to blank off the top of my head where he is.
Of course, I asked that, but anyway, I was just curious because I couldn't remember. I have definitely seen.
He's at Northeastern University. I knew he was up here.
Okay.
If you want to ask me again, but
sorry,
okay.
I know you deal with so many, but that is just exciting stuff right there.
Very.
And as well as, if you guys just scroll through some of these topics of research that are currently going on right now, that GLA is funding, it's incredible. I mean, different types of for instance, electrocardiogram as a Lyme disease screening test. I mean, crazy. That's wonderful. Again, with the suicide research study, but also just all sorts of things that are going on, and comparing different other reports. And these are all things that are going on currently and are very exciting. And I do highlight, of course, the pediatric side of things, because those are our biggest Lyme disease. That's our biggest community, actually, are the children that contract Lyme disease and tick-borne illness. So, my hat's off to GLA for really tackling some of these tough areas of Lyme disease.
Tough areas,
Yeah.
It is. And yeah, children, and then individuals that are like 50 and older tend to be our most vulnerable communities. And children in particular, Lyme disease, if anyone's been impacted by Lyme or any other tick-borne disease, it's a very subjective nuanced symptoms. I mean, Allie, if you and I were both exposed at the same time, you might have swollen joints and a bullseye rash and a flu-like feeling, some of those more traditional symptoms. I might just have a headache or GI issues or recurring fever. And so when children get sick with Lyme disease, there's a lot that happens there, but it's often quite an adventure to try to figure out, wow, this really is a tick-borne infection, because sometimes they can't self-report very well, or you just didn't see that tick that came through, and so you're just not even thinking about it. They catch a lot of bacteria at school, whether in daycare or elementary school, and you just don't quite know. And then, of course, if you get into the teenage years, there's a lot going on, and you could write that off as a regular virus, or man, we just keep getting hit with cold after cold after cold until it really has this prolonged impact in your body. Doing research with children is also very complicated in all disease spaces. It's a really tough decision for a parent to say, I'm going to, take that time to put my child through a study, or I might subject them something that could be harmful to them. And that's a big decision. So just doing clinical research for children is difficult across all disease spaces. One of the prominent projects that we're working on right now, and we've been working on for a handful of years, is actually a Lyme biobank. It's the PD Lyme Net. You can read about it on our website. But this is the world's only pediatric Lyme biobank. And it's associated PD Lyme Net. So the network is a network of 8 emergency room departments in Lyme endemic areas around the country. And the aim of this project is to ensure that children get the right treatment at the right time and gather that clinical data. And so that data that they're learning from the study is getting shared with other researchers. And they also share the samples that they have. So they collect samples. They actually host them in like a bunch of refrigerators. This is out of Boston Children's Hospital. And so if researchers are working on something, especially researchers in our network, they can get a fast track to some samples that they can start testing on children's cells to start to understand, well, does my diagnostic test work here? Is it the same? This saves time, it saves money, it saves a lot of anxiety, and it's such a resource for the research community right now. So that's another project we're very proud of when it comes to supporting children.
That's huge, because I often think that that's where all this testing should start.
Yeah.
I mean, why is Lyme disease the last test on the chart? It should almost be the first, because there are so many other big disease symptoms that are similar. And if you're just checking for those first and foremost, you're missing, as you know, people go years and years and years, and children cannot really articulate what's going on in their body. They're just weak or miserable or something in the ER. And at that point, it's really, really tough. Very. So I also want to talk about something that I think is important, because a lot of times people will say, I love my doctor. I've been going to them for 20 years. They have no idea what I'm going through, or I feel like they're missing something, or they did miss it. Talk to me about how, you guys educate healthcare professionals and get them up to speed with Lyme disease and being able to treat it accordingly.
Yeah, that is and still remains a huge gap in the community, is educating mainstream general practitioners in endemic areas and outside of endemic areas. We know that Lyme disease now exists in every state in the United States. So, even folks who might not live in an area that has an emerging tick problem, they are traveling domestically, or their family members are, and ticks can hop onto a suitcase and come all the way to Tennessee, and you can get infected there. And so this is a huge problem. And GLA, what we're doing today is investing in education. So our website, as you said, is full of resources. We have a medical advisory board, which is composed of medical professionals that are treating. They're Lyme literate medical doctors, is what the community calls them. And so they are a resource for patients who've been impacted by tick-borne disease. And we have consultation with that group on a monthly basis. We bring topics to them that help inform our research strategy. We get feedback from them of what's going on in the community. Just recently, we launched a survey that went out to the full community. It was patients, medical providers, researchers, folks from industry, our board of directors, and we pulled all this data together that can help inform our next round of strategy. But we're constantly asking the medical community, what do you need? What do you know? Coming in 2024, you're going to see two new webinars come up on our website. We're in partnership with an organization called Invisible International. They do phenomenal work. They have free accredited webinars on their website. And so they went and did the painstaking work and the deep investment in terms of financial resources to be accredited. And they're out combing the community and creating these wonderful webinars. So it's continued medical education for healthcare providers, their courses. But if you just want to learn, it's free for the community to participate. And GLA is going to start we're creating an alliance with them so that we can feed them what we know is coming in terms of the most innovative research and what they can get their hands on and be ready for a webinar as soon as it's ready to hit the market and we don't have a big delay. And we're going to help boost some of the webinars that they've created. So that's just one way that we're helping to educate the community. We do have other webinars that we issue out. For example, just recently, we were talking about a partnership with Quidel Ortho diagnostic company. Quidel is a wonderful partner of ours, and they've come to market this past year with a tool called the Sophia 2. So this is a little black box that lives in a doctor's office. It's very cheap. It's about $100. And what it can do is that the box you can insert a cartridge right in like a urgent care or a general practitioner's office, and it can run a test that's very similar to the lab version of the two-tiered Western blot test. But you can get your results within 15 minutes versus having to wait 5 to 7 days for a lab result to come back, and which is progress forward, right? Because
Wow.
as you said, Allie, how do we get that test to be in the top when I present at a urgent care and I say, I just haven't been feeling well, and they test me for flu and they test me for COVID, and there's no Lyme test right there, right? And we know we live in a world of instant gratification. So for us, we're very proud of the product that Quidel Ortho has put forward, the Sophia 2, which gives this little insert cartridge, and then within 15 minutes, it could show that you have a positive test. Of course, it's looking for antibodies. It's the same setup as we have today. There's other really exciting research that's coming out that's moving us towards a direct diagnostic. But we're very, very happy because this is going to make it top of mind for physicians to say, okay, I'll run flu, I'll run COVID, and I'll run a Lyme panel.
Absolutely.
Very
I mean,
happy
it's
about
a
this.
game changer. And with COVID, I don't think it's the timing of medication to infection might not be as important as with Lyme disease. Lyme disease can begin transmitting into your blood within 10 minutes or so. I mean, I had a tick attached for about 7 minutes, and within 24 hours started feeling those first symptoms. And it was no joke. It was one of the more aggressive ticks that carry tick-borne illness, and I knew it. But I'm in this world. I mean, I would have never put the two together had it not been for that. So I understand that, and I was able to immediately begin treatment. And so having something like that in the ER is critical for our patients because they need that. They need to start administering medication ASAP. And I mean, as we all know, really lowering that load is huge. So that's
And
really exciting for me.
talk a little about diagnostics for you, Allie, because you asked me that at the top and I didn't get to it, but this
Yeah.
is a great segue because unfortunately, that what we are still looking at is what we have to market is antibodies tests. That's the test that exists today, right? We all know a little bit too much about testing because of COVID, but basically you have to wait for your body to have enough infection, to have enough antibodies that are fighting that infection to be able to definitively test positive. So the best recommendation right now is, even if you find that tick bite, is to wait 6 weeks before you could test positive, before you should even test, because you might get a false negative if you go too soon.
Mhm.
One of the issues is, among many, is that we know that tick-borne disease is an immune suppressor. So if you're infected with COVID, you could have tens of thousands of antibodies, in the same period of time. A tick-borne infection might have 10. It's not going to produce a high number of antibodies, yet that's the way for this whole period of time since we've known about Lyme disease in the mid-70s. That's the way that we are looking for this. And what we really need is a direct diagnostic. A direct diagnostic would not only be able to find out early if you have that bacteria in your system, so you can start antibiotics way earlier in the timeline and prevent any deep infection. It's also going to help understand who has a new acute case of tick-borne illness versus something that's been in your system for a while. And what do you have? You know, a tick can carry up to 12 different infections or parasites, and you can get a lot of different things from a tick. We talk about Lyme a lot. You know, I'm sure some folks that listen to you have heard of Rocky Mountain spotted fever or Powassan. Sometimes those are on the news, but there's a bunch in there that you have not heard of that can make you equally as sick. So we need to be able to have a diagnostic tool that can look for all of those potential nasty little bugs that you could get from a vector-borne disease or a bug bite. So we do have exciting research. It's very early on, but if your listeners want to look into it, Dr. Brandon Jutras is a professor down at Virginia Tech, and his team is working on creating the first ever direct diagnostic test for all stages of Lyme disease. So what they've discovered is they have found a unique biomarker. It's called peptidoglycan. And this biomarker only exists in your bloodstream if you have been exposed to Borrelia burgdorferi, which is the bacteria that creates Lyme disease. And that right there is the map that you need to create a direct diagnostic. Now, what he needs now is he needs resources, which we're very happy if you Google. I'm sure if anyone Googles him, you're going to see that he got a couple of grants from the government this past late spring, early summer to continue to do his work. GLA is going to continue to fund him. Other organizations are stepping in and funding him. So this is the exact beacon of light that GLA likes to shine on the work that we know is the most promising. So we started funding Brandon many, many years ago, and now his work is really producing some excellent, exciting results. And others are coming to the table saying, let's get this all the way proved out and all the way flushed through. Still, if he had every dollar he needed and every researcher he needed today, it takes time to get this all the way through. So time and patience, but this is what we're doing, that time and pressure.
I love it. And it is exciting. I mean, I feel like I'm turning into a science nerd right here before our very eyes, because
I see it.
It's like it's making an impact. And I know it does take years and years, but it's so important for our people to have hope that somebody's doing something, you know, because they're just, with every day that goes by, it's loss of quality of life for so many people out there suffering. Another research study that I found exciting was just about various herbs for babesia. And I thought that was kind of an incredible thing to look at, because I've talked about herbs for so long, but not many people give it a lot of credit. And that particular research study is showing that these herbs are actually doing something in the body. They're actually working. They're actually impeding the babesia, which is one of the hardest tick-borne illnesses to eradicate in your body once you have it. So that was exciting for me too. I mean, there's just something for everybody on the website, and I'm sure they're updated every single day in terms of
all the time
studies. But one thing I wanted to also talk to you is about peer-to-peer support group. I have my own peer-to-peer support group, and it's so important for people to connect with each other. We have about 900 members, I think, right now. So we're in the baby stages, but talk to me about peer-to-peer support group and financial support for our listeners.
Yeah, so aside from the research that we fund, we do offer support for patients today. So the 3 programs that we have an ambassador program. That is an ability for anybody who feels empowered to educate their local community or step up and get involved or help to fundraise or help just spread the word about GLA. We have resources, onboarding tools, and a program set up that you can be a volunteer in your community. So if you have been impacted and you want to make sure that your neighbors know what they can do and get the support that they need, you can sign up to be an ambassador through our website and empower yourself to make a difference in your community. We have also a healthcare referral program. This is a service that is helping navigate patients to the right physician or healthcare provider that can help with their specific needs. And then we talked about at the top that you and I could have very different symptoms, right? So if we present to the general medical community, we're going to get tucked into all sorts of specialists. If I have migraines, I'm going to end up going to an ENT or a neurologist, and I'm going to go down this whole path that's not really going to solve the problem for me, right? You might go on a different path since you're presenting with a bullseye rash and all sorts of things. But let's just say we're both lost in the medical system. If we know it's tick-borne disease, or we are suspicious it is, you can go to our website. There's a form you can fill out, and a real volunteer will get that application and be able to say, well, okay, you live here. This is your best opportunity. This is a doctor who will know what's going on. Go and see this person. Or if you do need to see a neurologist, but you know your issues are based on a tick-borne disease, which neurologist you see kind of makes a difference, because
Sure.
one might really understand and be able to appeal and talk to you about what's happening from your infection, whereas another one might not be as educated. So we have a database of Lyme literate medical doctors and healthcare professionals. Really, there's naturopaths in there, nurse practitioners. So broad term is healthcare providers. But if you feel lost, or you know someone who needs that support, go to gla.org. You can go to our resource tab and you can find that resource. And then finally, our third program is our peer-to-peer program. No matter what you're going through, whether it's a struggle or an opportunity, having a peer that gets it really makes all the difference in the world, right? Even for me, stretching to a role like this, I have several other folks that are CEOs of nonprofits that I can call on and say, oh, don't you just get it, right? You get it?
Sure.
Here's the good, here's the bad. What would you do, right?
Mm-hmm.
That's what this program is established for individuals who are needing support, that are going through a tick-borne illness journey. And so we have, you have 900 people. That's pretty good. We have a little over 600 folks that are looking for matches, and then about just shy of 300 that are willing to help support. So we do have an emerging need that we're getting a substantial amount of people that are coming in saying, please give me a mentor, and not as many mentors to match with them, particularly men. So if there's any men listening to this podcast who have been through this journey, if you're willing to talk to others and just share, like, this is how I talked it out with my boss. This is how I communicate it with my family. This is how I manage my responsibilities. I was able to get an accommodation to work from home, etc. Right? So aren't healthcare providers, there are people that have walked in your shoes, and they're there to help guide you. And transversely, if you've walked this path and you feel that you're in a position where you could help others, we would love your support. So I believe, and this program was here before I came in, but I believe that the very, very best support that you can get is somebody who says, I get you, especially when you're lost.
I love that you encompass all of that as well, because not many organizations, they tend to specialize in either the research or the funding, whatever it is, and often leave off this very last part, which is what people really need in the day-to-day, and what between doctor's appointments and when they're out there just wondering. And I want to just clarify, my support group is just peer-to-peer. It's not necessarily designed for advice or anything like that, because what works for one may not work for another. But they are just there to swap ideas and to share and to just do that in an online way. But what type of process is it to become a mentor?
Yeah, there's an application online. I mean, you can just fill out, tell us a little bit about who you are.
That's easy.
And that's easy. Where you are demographically, and, to the best of our ability with what you went through. Say if you had Babesia, or if you had Lyme disease, we like to match the pairs up, as close as we can. So if you needed support, Allie, it could be someone that is in a similar demographic, maybe on the same area of the country. You might have had the same disease, although we know your symptoms might not be the same. You might have a similar path. So we just ask some questions so that we can match you up. We use a software called Mentorees that actually does the matching, but we have a staff member that reaches out to all mentors interviews them, helps to make them feel comfortable. We do an orientation so you can be equipped to answer questions about GLA, answer basic questions about, hey, if they ask about financial resources, this is where you can send them. And so you can start your first conversation feeling really equipped. Most of those conversations are just, I just want to unpack with someone who gets it,
Sure, sure.
and that's primarily the journey. We don't ask anyone to be a therapist or a healthcare provider. It's just, I get it, right? Here's a life hack along the way that might help you feel a little bit better. But most importantly, I'm going to provide you with empathy, and I'm going to validate that this is real and you're in it and you're not alone.
I think
That's
it's really important that you said that they might share a different graphic, because I think that's even more important than actually sharing the same type of bacteria with somebody, because as you know, we all present differently, even if we have the same co-infections. However, I contracted it outside of the state, then came back from vacation, and then 2-3 months later I was in bed. And so nobody in California thought to ask me where I had just been, or anything else. And I was thinking it was not a systemic problem, but just something wrong with my feet or my joints, or my brain fog. So I was really out there for a long time, which is why I started doing what I do now, because I couldn't figure out why in the world I live in California and have access to the best doctors out here, and nobody could diagnose anything for 6 years. It was really maddening. So I love the support, the peer-to-peer. I love the mentorship. Would you say that's the biggest call to action or one of the top 2 or 3 that you have right now?
Yeah, I think if, obviously if someone says, what do you need? We need financial support. In order to do this research, we need the resources. So connections, donations online, anything that folks can do, matching gifts. We do fundraising opportunities too. So if you don't have resources to give, you could always get a website and have a birthday fundraiser, do something online. That's always going to be our most important asset. But second to that, Allie, is definitely more mentors right now. Just folks that are willing to support those that are lost. We're seeing our mentee request growing at a rate of about 30% month over month. And we've been carrying that for the last
Oh my
4
gosh.
months. Yet
Wow.
our mentors are growing too, but it's at a much slower rate. And as I said, having men willing to be mentors is really, really important. And we don't have nearly as many men in the pool of mentors. So again, we want to match people up as best as we can. TIC does not care if you're a boy or a girl, right? It does not care. And so that is not something that is aligned down the demographic of folks that are sick, but we do find that there's a big shortage in men that are willing to have those vulnerable conversations with others. And so if you're out there and you're like, sign me up, please go to gla.org. You can drop right into the resource page. You can go to the tab about peer-to-peer, and right there you can put in your application, and we'll have an interview with you shortly and tell you what you can expect in a more detailed format.
That's wonderful. And speaking of men, Christopher Maloney, I mean, come on. I love listening to him speak about Lyme disease. It's incredible. What kind of things is he lending his name for you guys for right now?
Yeah, so Chris has just been an absolute pleasure to work with. So at my first GLA gala, which was in 2022, he came in. He was only able to come for the red carpet. He was there for like 15 minutes, and I didn't even get a chance to meet him. And I was like, well, I guess I never will, right? I just thought I was so intimidated by him. And it was shortly after that he saw The Quiet Epidemic, one of the 2 new films that came out that really dive into the reality of this disease and the journey of patients. The other one was I'm Not Crazy, I'm Sick. They're both very good. If you want to jump into this, if this is all new to you, on a cold night, you can stream both of those, and they're both very good. So Quiet Epidemic really goes into where the medical system sort of broke around this disease, and the journey from when we first discovered this all the way up to today. And it's just a very informative film. And the I'm Not Crazy, I'm Sick film is truly that patient journey. So for anyone out there that feels invisible and the people around you don't quite understand what's happening, and maybe you don't either, and you're looking for some validation, that's the film to go and see. That came from a family that is in it. And it was born out of passion. Both of them are passion projects, but that one was just like, this is what this really is. And this is what it's like day to day to have to relearn to get some basic skills back and lose parts of your body, even if you're young and vibrant, and just suddenly everything turns on a dime, right? So they're both very good. Chris saw that. And soon after, he took a meeting and said, I want to help. I want to do this.
I just
And
got
so,
chills. I mean, I got chills because there aren't many people willing to lend their voice in that industry.
yeah, Chris is very unique. He's just a wonderful guy. You know, I can't believe how I say normal, but he surprises me all the time with just, he's just a guy who has watched people in his world be very, very sick and struggles through the same thing that you, Allie, went through, and others that are listening to this went through. He has watched it firsthand, and he knows that he can give himself to this platform and make a difference. He says, just set me up. Like, I'll do it. So far he's in a PSA for us. If you haven't seen it, if you go to our landing page today, it's still right there at the top at gla.org. If you click on his image, you'll go to a page that talks more about why Chris is involved, and then you can watch the PSA. It's also until the 31st of December running in Times Square at 34th and 1500 Broadway and 34th Street. It's running up on one of the screens. It airs like 82 times a day, which is really exciting.
That so much. I love that so much.
It's great.
Maybe that's why the New York Times just did another piece on Lyme disease. Let's just shout it. I'd like to think
there's a lot of buzz right now about Lyme, but and I want to say, shout out again to Quite Out Ortho, because they're a partner that helped us do that. So they help sponsor it. So we're not taking money away from research or our patient mission services to be able to do that. Chris has donated all of his time as well, and just been able to really support this. So that's running there. It's distributing across the United States. We're trying right now to see if we can get it to do some streaming platforms. Everything's like $1 to research, $1 to awareness. And so, we're working on all of our partnerships. Chris went on Good Day Today on a national broadcast to talk about GLA's mission and Lyme disease, full stop. He was on Good Day LA. He was on Good Day New York. He's been covered and quoted in People magazine several times from the gala pickup, but also he did an interview for them, which was a printed article on people.com. And so it's just been awesome. He came to the gala this year, he spoke, that got a ton of press around it. And just everything he touches just lights up this disease space. And what I love about Chris is every time he gets in front of this and we're preparing and we're going to start talking, he says, I just want to make sure I do best by the community. I want to make sure that what I'm doing makes a difference. Like, is this sharp enough? Is this direct enough? Are we getting a message across? Right? Because sometimes you just want to be light about it. And then sometimes you can be very heavy with it. And he always wants to lean to the side of heavy because he believes that he can help make a difference here. We went on Giving Tuesday. We did an Instagram live together. You can still go to GLA's Instagram page and watch it, or to go to Chris's page and watch it. But
it worked. I donated.
Did you? Thank you.
Yeah, of course. I mean,
and his check is in the mail. He's sending one. He's just texted me yesterday. So he's just the best. But he takes that very seriously. He takes all of it very seriously, and he's going to continue to partner with us. And every opportunity we get, he's when he can and where he can, he's always been willing to say, yes, let's do it.
That's amazing. I love that for you and in your organization, because it really brings it to life, and it really helps people identify with somebody that they're used to seeing and really listen to what they have to say. And I just love that. And yes, I mean, the Tick Chicks, just a reminder, we do events and any sort of, I also do affiliate relations with some things, and every single penny of that goes to Lyme disease research and events and awareness. So we're excited about that as well. So
thank you for that.
Are there any last thoughts that you have for our listeners out there? And also at the very end, can you just tell them where they can find you on the different platforms, please?
Sure. Yeah. So I guess my last thought is this has been a very, very, very long, slow journey for a lot of patients out there. I mean, even if you've only been in this for a few months, it feels too long. Some of you have been in this for a few decades. And so what I want to say is that help is coming. There is a lot of work that's happening out in the community globally and domestically that's going to make a difference for you and the people that you love. And so if you need support today, please reach out to us, get involved in our community. I think in 2024, you'll probably see GLA, probably me, but some of my colleagues too, talking more about this, like this, Allie, and getting more open about what we're working on. We know this takes time, and we know we're out of time, and we know no matter what we do, it's not enough. And I know that, but we are focused and steadfast on making a difference here. And so come to us if you need support. You can find us on Facebook, Global Lyme Alliance. You can find us on Instagram. It's the same. It's Global Lyme Alliance. We are on LinkedIn if you happen to live most of your world there, which I do. So that's where I am. We are on Twitter as well. It's gla.org. You can sign up for our newsletter. We have a monthly newsletter that goes out that's calling to action all of this. Like, you go to our website, there's a lot of information. The newsletter is going to say, here's the most important. You can focus on this. And if you want to have a conversation directly with me, I am a door wide open. So, you can reach out to our info@gla.org, and the team will help connect us if you have a specific thing you want to be involved in. Let's start doing it, right? There is a sense in the community. There's something in the air right now, I think, coming off of COVID, having a more educated community at large, where we feel this bubble of excitement and new potential research that's coming to market. I think the next 3 to 5 years for Lyme research is going to be incredibly exciting. So get involved now, stay tuned, tap in, learn more. And if you have a voice and you have an opinion, please share it with us. We do listen. We do read every comment on social. We read every email that comes in the info@GLA box. So tell us what's going on and help us solve this problem.
Thank you so much, Laura. I just am so happy that you carved out this opportunity to speak to our listeners. And, I would just encourage everyone, Lyme disease puts you in bed a lot. It puts you on the couch a lot. You're unable to really do anything physically, but you still can use your voice. You can use anything that you have, any resources that you have, put a little donation into them every single month, even if it's just a little bit. You will feel mentally as though you are taking charge of this disease, and you will feel as though it doesn't define you, and you will feel as though you're helping somebody else if you sign up through their mentorship program. So lots of love to everybody. Thank you again, Laura, and I hope that you will come back on the show soon.
Anytime. And thank you so much for the spotlight for Global Lyme Alliance. We really appreciate it. Anytime you'd like to invite us back, we're happy to participate. I'll even drag my CSO, Dr. Timothy Salati, on if you want to ask him some really key research questions.
We'll have a party. We'll have a science nerd party. And
there you go. We'll nerd out together.
That sounds good. Okay.
Thank you so much. Bye-bye.